Hi everybody. It's been a minute. How you doing? Yes, it's been a couple months since I've put out a video. And there's been a lot going on. I had a surgical implant of a nerve stimulator, and overall it's helped. It has not made my chronic pain completely go away, where I don't need assistance of other therapies, but it has made it so I'm sleeping better and it's more tolerable. I'm more of in a tolerated level of discomfort. And I'm finding myself having more energy to do more things. I've put some dirt in some pots and I'm trying to start little seedlings, and yeah, that's how that's going. Patient advocacy, something I've mentioned before, not just for yourself, but for a loved one. Going through that right now, helping a loved one who has come across having some severe depression, and trying to weave through the doctor's offices to get help. So I've had issues where I'm calling doctor's office and I'm in a bit of a panic because my loved one is so deep in the trenches of depression and anxiety and fidgeting and everything else that I'm just trying to help them. We've had a couple appointments with the psychiatric nurse practitioner, and my loved one has been put on medication, 3 different medication, and I know it takes 4, 6, 8 weeks to reach peak blood levels, but in the interim of the first couple weeks, my loved one hasn't been able to sleep well, and sleep can be so important. So trying to get medication to help my loved one sleep, and we're starting some psychology treatments, talky talk, because I think it's helpful. And my loved one really liked the therapist that they sent us to. The therapist is an older feller, but he's very calming, and my loved one wanted me in the therapy. It was telehealth. I like telehealth because I don't like waiting in doctor's offices for an hour before the appointment and 15 minutes to 30 minutes in the office waiting. So the telehealth has worked well for us. Trying to navigate to get this doctor's office to do what we need has been a challenge, and I'm glad I'm there for my loved one. 2 prime examples is we showed up for telehealth appointments in the last 2 weeks. First time was a 5 o'clock appointment. Okay, some doctors do later appointments, that's fine. And we were checked in, patient checked in, it said patient checked in. Naive me didn't call till 6 o'clock when the after hours person answered the phone. And apparently doctor had said that they tried calling twice and no answer, so and left messages and canceled the appointment. On our register on our phones, there were no calls. Okay, so we had ourselves switched to another provider with the help of a case manager through my loved one's insurance. Same office, different provider, because I don't know. Was it a lie? I don't know. Anyway, so we had had an appointment 2 days later, and this was the first initial meetings of my loved ones with this office. And the next time, we were given a 4:30 appointment, so we checked in at 4:25, and I called at 4:35. Hey, so-and-so is checked in for provider. Okay, we'll let the provider know. 4:55, I'm calling the office. So-and-so is all checked in for their appointment. Oh, well, the provider went home. You've been canceled. No one called us. Oh, well, I can make an appointment for you tomorrow at the time. I said, well, unfortunately, we have a appointment for something else that we've had for 6 weeks, and we can't cancel that appointment. Oh, well, yeah, well, we can get you in at 9 o'clock tomorrow. I said, again, we will be on the freeway driving to our appointment that we've had for over 6 weeks, and this is a very important appointment, and do you have any other days? Oh, well, okay, Friday at, I forgot what time it was. And that day, I called the case manager, well, the next day, and she got a hold of office manager, and that Friday, my loved one had their appointment after a week and a half of shenanigans. If you want to know what the word shenanigans means, that's shenanigans. So, medications written, started, anguish, and trying to be there for my loved one is very hard. As a advocate and a caretaker for this person at this point, because of the situation of their depression, I have really had to concentrate on also taking care of myself to be strong for my loved one. Being an advocate also for myself. I was almost ready to call my doctor's office for an antidepressant myself, but I'm trudging through, trying to help my loved one. It's been about 2.5 weeks on the medication. I can see little glimmers of improvement by behavior, should I say, not demonstrating such a, I hate to say this person looked like a tomato plant. You have 2 tomato plants, right? 2 tomato plants. And they've been well watered. And then one starts not getting water. So this is the normal. And this was my loved one. So, at this point, they're standing up straighter. They're eating better. They're having thoughts that are a little bit better and more into focus of the wide world versus just the tunnel vision of regrets and frets and anguish. They say they don't know how they feel. They say they do not want to harm themselves. So it's a matter of time. I've always got my eye on him, this loved one. So I'll keep you up to date. Hence, you must be your own patient advocate and the advocate for a loved one that needs you. It's not easy. It's draining. It is agonizing at times. Especially when they first come into it and they don't want to go to the doctor. They just want to be left alone. There was a lot of calls. Hi, this is Susan for so-and-so. I'm speaking for so-and-so. Would you like their permission? Speak into the phone and tell them it's okay for me to talk. Yeah, it's tough. Anyway, that's what I've been up to. What you been up to? How's your weather? It's cold here in Southern California right now. I know I complain about the 95 to 100 degree weather, but it's cold. Anyway, gonna go home, make some lunch, carry on. Have a great day. And be a patient advocate for yourself and your loved one. Bye.